Greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you about a very important thing if you do a lot of advancing of lower anterior teeth, especially if you have somebody who swallows and uses a real tight lower lip here. Your lower lip can pull back with a tremendous force against the teeth. And if you want to move these teeth out into that space, you've got to run interference for them, for you have to have a soft vascular bed for the teeth to go, where bone can form in that area. So that's where lip bumpers come in. Now up above, you have very few people, but we use lip bumpers up there, in some cases bringing them way out like that. On the side, you don't have to worry about that. There's no tightening of that on the side, but on the anterior, lower anteriors, you really have to use something to run interference for the teeth. Now let me get into this picture and we'll show you. This is a real nice lady, but she's got a tremendous overbite, and this looks like the overbite is about 12 inches. I mean about 12 millimeters, something like that. I don't know whether, let's see, I'm going to have to get back over here and get me a little pen so I can draw on here. But we've got a distance in here, and the person nearly always will have some kind of problem with pulling the lip back and putting pressure on it in here. And so you have to, if you're going to try to move, see, this jaw needs to have this tooth right here ought to be something like this. In other words, we need to bring this lower jaw forward, or bring this back to some extent, and have the two to get it corrected in here. So let's see what we do here, and I'll show you. Maybe you can carry on with it. You see, we've got to, that's not clear in here, but anyway, these teeth are way up at the roof of the mouth, right like that. Now when you look at her, you look at the jaw, and you would like to bring this chin forward like this. We cannot make this jaw grow, can't make it grow, but you can bring it forward with a ramp appliance that makes her bite the jaw forward. And so the condyle back here at the back, where it'll lean backwards, and that helps the jaw come out, and this angle down in here will get greater, and that allows the jaw to come forward, but the jaw is the same size, the angle and everything, but the jaw is no bigger. So we'll go, now looking at it from the front, you don't notice this pulling back, and then she smiles, you see that lip pull way back in against those lower anterior teeth. And so we want to change that, and we want to fix it. And these teeth, a little problem in here, got to kind of keep that scaled out, have the assistants scale these every time they come in and keep them cleaned out. And then you're going to put a lip bumper back here, and it's going to come up and have a deal in this part of the mouth that'll keep the lip pressure from pushing against these as we expand those teeth. And you can do that, but you have to be careful and keep this in. Now that's the same way over here. And up above, she's looks like got some crowns on those teeth, and the basal part of the crown showing out here. Now down here, we're going to have to bring these teeth out, and we're going to have to run interference for them. So here's what we do. You can make your own lip bumper, or you can get one that fits into your, put a headgear tube in here. I usually use 2 arch wires, put a lip bumper just made out of 018 arch wire in here, but put this in and it pushes forward, and you've got some space between here and the teeth. And now we're going to try to lower these teeth. We're going to open the bite and at the same time bring the teeth forward in that. And we're going, with the uppers lined up pretty good in here. These are crowns that we've got on here. And you, adult orthodontics, you're going to run into a lot of this stuff. Now, let me get over here. This is a bought lip bumper. I don't like to use them. I like to just run a double deal and make the lip bumper out of a rectangular wire. And here, but we've got the lip bumper here, we're just using it. And we're going to level this bite out. And up above, we'll put a bite plate and put it a little ramp on the bite plate. And they can't wear it too much because it puts all the weight on the jaw joints back here, the teeth is the anterior part. So you can wear it some and sleep in it or use it. And then the lower anterior teeth, where these teeth come back in contact again. And now we're going to continue to go down as we expand this back. And now we've expanded and got the teeth in, but we still need to put intruding arch out here to bring this down, and have your lip bumper is running interference for this. Now the force that we push back with the lip goes back to the 6-year molars back here where it's, the lip bumper's attached. It pulls that back, and you can use that to bring the upper anterior teeth back in. Just turn it in reverse on there. So now we've got this out, and these teeth are lined up pretty good. Out here we can expand the lip bumper. You have a kind of a U in the wire, something like that, and you straighten that out to where it's kind of like that. You know, and that pushes the wire forward out here and keeps the lip bumper away from that. Now, here we are. This is the same lady now, and when she bites together, these teeth are out with the other teeth, and they've still got bone structure on them. So we use this lip bumper to bring it out there. So you've got to run interference. It's absolutely necessity that you put something in there to, if you're going to bring those teeth forward, you get the bone, got to fill in and work out like that. And you have to keep these kind of cleaned off while you're doing this. And they come in, you do a little scaling of those teeth and make sure they're clean and everything else. And you bring them out, and you can actually level those out. Remember, those teeth were way up here. We pulled them down in here and guided the root, and we put them in a space. And we had space between the lip bumper. It's got to have a millimeter or so of space in there so that none of this lip pressure, it'll go down the deal to here. And then you can take hook on there with class 2 elastics, and you can take this lip down here and move the upper front teeth backward with that. And so we reduce that down like that. And so here we are later on in the case, and you darn sure want to put a bonded deal in here, and you'll make sure they wear this thing or it'll shove it back. Now, thank you for watching, and this is not impossible to do, but you need to understand that you have to run interference so that the bone can grow as the teeth come forward. So thank you for watching, and I'm going to hang up and say goodbye, and I hope you'll join our group and subscribe to it.